Good morning, good afternoon, everybody rather. Can I begin today with an update on the current situation? Firstly, we are still in the process this morning of verifying the numbers of confirmed cases, so I'm not able to give you a number right now, but that will be published at 2 o'clock in the normal daily briefing. However, I can tell you, and do so with sadness as always, that there have been a further 6 deaths of patients who have tested positive for coronavirus, which takes the total number of deaths in Scotland to 22. And I want to extend my sincere condolences to all those who've lost loved ones. I can also give an update today on the numbers that we know are being treated in intensive care. As of last night, there were 51 patients with COVID or suspected COVID symptoms in our intensive care units, and I'm sharing that information to demonstrate and underline how serious this virus can be and why the measures that we are asking people to follow are so important. Of course, that is a number that we would expect to see rise in the days and weeks to come, and that also underlines the importance of the work that is being done to increase the capacity of our National Health Service. And let me take the opportunity now again to thank our NHS staff who are working incredibly hard, doing an incredibly courageous job in these circumstances and continuing to care so well for people suffering from this virus. I also want to take the opportunity to thank the many other people whose work is so vital at this time of crisis. For example, to thank those who are caring for people in care homes and in the community at an immensely difficult time. And of course, there are many other people. The staff in our supermarkets and other essential stores are an obvious example whose work is absolutely critical right now to keeping the country going. All of your efforts are hugely appreciated. As we've been saying over the past few days, it is clear that we are now seeing a rapid rise in coronavirus cases in Scotland, and we have sustained evidence of community transmission. So I want to make clear again to people across Scotland that it is vitally important that these unprecedented measures that we're asking people to comply with are complied with, and that people observe and follow the advice. So can I thank people across Scotland who are cooperating and showing support in what is a very difficult time for everybody. And to give some evidence of that cooperation, I can tell you that bus companies have reported a fall of over 70% in concessionary travel journeys. And I will also confirm today that to support these companies at this time, the Scottish Government will pay them for the concessionary travel that they were forecast to provide, rather than the concessionary travel that they do actually provide. And that will deliver support worth tens of millions of pounds to bus companies at a very challenging time. I also want to say thank you to parents. There has been a lot of coverage in the last few days highlighting examples where people are still coming to terms with the virus and the implications of the lockdown. We've seen trains that have just been too busy, supermarket shelves that are empty. But we should also remember that the vast majority of people have listened to advice and are acting responsibly in the interests of the whole country. Last week we announced school closures and said that only vulnerable children and children of key workers would get a place in childcare. At that time we were, I can tell you, deeply worried that the numbers seeking places would mean that we would find it difficult to stay within the health guidance. We were worried, therefore, about the safety of pupils and teachers. So we asked people to be creative in finding solutions without using a childcare place, and asked people to help us keep them and their children safe. And the result of that has been extremely positive. Initial estimates, and I would stress initial estimates, this number will doubtless grow a bit as the days and week pass, but initial estimates show that there are only around 1% of people who are taking up these childcare places. That is, I think, good news, and it is a positive sign that people are complying with these necessary restrictions. And everyone who is following this advice and behaving in this way is helping us. Every single person following this advice is helping us to slow down the spread of the virus and ultimately save lives. At all times, the Scottish Government's actions have been guided by the best and most up-to-date expert scientific advice, working closely, of course, with governments across the UK. But as the number of cases increase, it is ever more important that we have the fullest possible understanding of exactly how the virus is spreading in Scotland. We need to be certain that the decisions we're taking are the most effective ones possible, and we need to know whether there are more steps that are required to be taken. So for that reason, I can confirm today that we're now seeking to supplement the advice from the UK Scientific Advisory Group on Emergencies, or SAGE as it is known. And we are establishing a new Scottish Government COVID-19 advisory group. It will be chaired by Professor Andrew Morris of Edinburgh University, who is Director of Health Research UK. He will be supported by a Vice Chair, Professor David Crossman, the Dean of Medicine at the University of St Andrews, and the Chief Scientific Advisor for Health at the Scottish Government. The Chief Medical Officer can say more about that shortly. If I can turn now briefly to the economy, I want to again say thanks to businesses who have heeded our advice over the past couple of days to close and to allow their staff to stay at home. Although the vast majority of businesses have behaved responsibly and heeded the advice to put the health of their workers first, I do remain concerned that some workers have been put under unnecessary and unacceptable pressure regarding their terms and conditions. So we have prepared further guidance for employers, which is being published today and follows the statement I gave in Parliament yesterday. Now, it can't practically or reasonably seek to answer every specific question that a business might have, but what it does do, as I did in Parliament yesterday, is set out clear principles that will help businesses navigate these difficult decisions. Of course, there will be some exceptional, nuanced or difficult cases, so we are also establishing a central Scottish Government resource and doing that urgently to provide advice and direction to businesses on these cases. But fundamentally, most businesses should and will know whether they should be closed, and we're relying on them to be responsible at this time of emergency and to act on the basis of the precautionary principle and put the health of their workers first. We've also been in dialogue in recent days with trade union representatives to consider how we best support the workforce. We need a partnership working in the national interest to get through the next few months, one that involves the public sector, trade unions, businesses, third sector organisations and all workers and managers. We're hugely appreciative of the many cases where this is already in place, but to cement that best practice, I can confirm that the Scottish Government and the STUC have signed a joint statement of fair work. This sets out our shared objectives for supporting employees and ultimately their employers through this difficult time. The statement outlines our shared belief that employers should be protecting the health and safety of all workers, particularly frontline or key workers who have particular risks, ensuring all workers are provided with clear and comprehensive information on work-related risks, ensuring that all workers follow health protection advice on isolation, either as individuals or in their households, paying workers while they are sick or self-isolating, supporting those with caring responsibilities, facilitating home working and protecting the position of contracted workers as well as core staff. Scottish Government, of course, takes our own responsibilities as an employer very seriously, and we're working to ensure that these standards are upheld here, but also across the public sector and right across the workforce. Lastly, today, before I hand over to the Chief Medical Officer and then open for questions, I want to say something about mental health and well-being. The last couple of weeks have brought probably more uncertainty and anxiety than many of us have ever known in our lifetimes. Many people, many of you watching, are feeling anxious about your own economic situation as well as about the virus, and you're anxious about how such enormous upheaval is going to affect all of us in the long term. Most people are spending almost all of their time at home, and whether that means being on your own or with your immediate families, being in a relatively confined space brings unexpected challenges for all of us. So it will be some time before life returns to normal, and therefore it's important that we all continue to look after ourselves and look out for each other. More than ever, we all need to be kind to each other. I can't praise people across Scotland enough for the way in which the country and communities have rallied round, and for all of our young people who are spending their first week away from school, it's probably already becoming clear that it can be a bit tougher to stay at home and off school than perhaps you were anticipating. So if you're feeling a bit overwhelmed with everything that's going on, remember that Young Scot has an excellent website which is full of resources and how you can help yourself to cope. And for parents, there are also lots of resources available to you. Parent Club, the Scottish Government's advice site, has all sorts of material to help with ideas and activities, as well as techniques for staying calm and solving problems. And if you're feeling under stress, Parentline Scotland, which is organised by Children First, is also a really good source of emotional and practical support. And for older people, I visited Age Concern last week and saw the outstanding support they provide through their helpline. And you can phone that on 0800 12 44 222. I'll end by making the obvious point. None of us, including me and the Scottish Government, are going to get everything right in the weeks and months ahead. And none of us are always going to feel fine or okay as we go through this really challenging period. But if we do continue to support each other and keep on learning and finding new ways of doing so, then, as I have said before, we can and we will get through this very difficult period. So thank you for listening. For the moment, I'm going to hand over to the Chief Medical Officer to say a few words, and then we'll open for questions.
Thank you, First Minister. As we've been able to announce today, this COVID-19 Scottish Scientific Advisory Group, chaired, as you've heard, by Professor Andrew Morris and supported by Professor David Crossman. We, at this time, think that this is very important, that we have bespoke advice coming out of that scientific advisory group from emergencies, but applied to our population in Scotland. So as I've said many times in this room, we've had a lot of cases in London, and we in Scotland have fewer cases. We are behind the situation there. So the advice about suppressive measures has been all over the UK, because that's what we need to stop the transmission of the virus. But in time, we will want to apply our own Scottish data to some of these advisory measures. Perhaps it will not be appropriate to have all of the suppression measures in all of the country as we progress through the transmission of this disease, and also as we see how the capacity of our NHS is holding up. The group has been hand-picked experts across Scotland. They will be represented on the SAGE group, but also will have our own modellers and expert scientists to advise us for the population of Scotland. I would separately like to reiterate the First Minister's comments about people supporting our key workers, and in particular my colleagues in the NHS and our colleagues in social care. I've heard from many frontline NHS workers their appreciation of the public's staying at home so that they can stay at work. They are undergoing changes in the NHS that we have never seen before. They are preparing our NHS for the numbers of cases that we are anticipating. They are working many hours, many extra shifts in order to have our NHS as well prepared as possible. I would like to thank them for the work that they're doing so far and for all of those hours and days that they will put in the future. And our population in Scotland can support them by adhering to these difficult measures, stay at home so they can stay at work.
Okay, thank you. Lisa.
I'd just like to ask, given what you said about you're hearing from people feeling like they need to go to work, compelled to go to work because their employers are saying to them that they have to do, is there nothing more you can do to make sure that these employers do not go to work?
We will continue to monitor this situation very carefully. What I have tried to do is recognising that it's impossible to answer every specific situation, should you be open or should you be closed. We've tried to set out some very clear principles. I did that in Parliament yesterday, and we're publishing guidance today along exactly those lines. So there are categories of business, pubs, restaurants, non-essential retail, that are very firmly being told to close. At the other end of the spectrum, there are businesses that are essential to the ongoing running of the country, the critical national infrastructure of the country. They cannot close down, but they should also be complying with the advice about social distancing and safe working, even there allowing workers to work at home if possible. Between those two ends of the spectrum, we are setting out some guidance and principles that we're asking all businesses to have regard to, and as they do, to act on the basis of the precautionary principle. So if in doubt, put the health of your workforce first and don't expect them to come to work. So the principles are, is what you're doing essential to the efforts against coronavirus or to the well-being of the country, for example, businesses in the food supply chain, for example. If the answer to that is yes, can you allow your workers to work from home? If the answer to that is yes, you should do it. If it is no, are you able to put in place safe social distancing practices and also make sure that you comply with health and safety requirements? Now, if you can't answer yes to these questions, then the precautionary principle says you shouldn't be operating and expecting workers to come to work. So I'm being very clear about that. I've been very clear about construction sites. I think at the moment they should be closed until we can look to see whether they can safely operate. We are going to establish in the Scottish Government a resource that will give a bit more bespoke advice where there are difficult cases here. But I'm relying on employers to be responsible, to prioritise the health of their workforce and to do the right thing. Seth.
Can I ask a question, please, to the Health Secretary? Both the BMA and the Royal College of Nurses this morning are saying that there are still often significant shortages of PPE and hand sanitizer across the country, all levels of the NHS. The BMA chairman has said to me this morning that they're treating fewer patients because his frontline staff and members are having to chase PPE supplies with their line managers all the time. And there are two questions that they have that come from that. They say, what is the Scottish Government doing to guarantee that supplies are being proactively pushed to the front line so doctors don't have to ask for them, they're already there? And secondly, what's the Scottish Government doing to monitor whether enough supplies are reaching the front line in time?
So both of those areas are in hand. We do actually need to know from primary care, as acute care, as social care, what supplies are needed so that we ensure that supplies are distributed equitably. There's no point in giving a particular part of the health or social care sector supplies when they already have sufficient. So we are aiming now to streamline how the ordering is undertaken and how the distribution in particular is streamlined to make sure that we have more than one distribution route, if you like, for those supplies. In terms of the availability of the supplies, the supply chain is working well, and we currently have no shortages of particular supplies like the masks and aprons and gloves and so on that are needed. What we also need to make sure, though, is that the clinical guidance that does exist is very clear to each part of the health and social care sector about what protective clothing they should have and require to wear. It's not the same in every setting and for every clinical procedure. And I'll say again here publicly, as I have said to both those organisations, that my door and my phone remains open for them at any point to raise those issues directly with me. I spoke yesterday with the chair of the BMA's GP group to work through with him a number of particular issues for GP practices. That was a very successful conversation, very productive, and all of the areas that I agreed with him yesterday have been enacted this morning.
Do you think broadly they're correct, though, that there are still issues about getting what they need on
I
time
think
in the right place?
I think we have always said that there are distribution issues in some parts of the country, so that's not news, but that we are working consistently to try and identify exactly what the difficulties are and then overcome those. And that will be, I am certain, a continuous piece of work for us in health and social care right through this situation.
I just want to make clear that this is an issue to which we attach the highest priority. Protecting frontline health workers, there are few issues more important to us than this. There are challenges here. There will at times be challenges of supply. Distribution will be a continuous challenge. We're adding logistical support so that we can streamline and make this as quick and as bureaucracy-free for those working and caring for patients at the front line. But I don't want any healthcare worker out there to be under any other impression, but this is something that we attach the highest priority to. Yes.
You mentioned that people want to look out for each other. One of the ways that many people want to do that is by volunteering, but they also want to make sure that they're doing so safely, that they're doing the the right sort of things that are required by the NHS and other public services. There is a perception within some of these groups that there's a bit of lack of national coordination of these efforts. What are you going to do to address that?
Well, if there is that view, we'll certainly consider whether we need to put more national coordination around that. I mean, I think there is, I see it from my own social media accounts, my own email, just my own personal contacts around the country, that there's an enormous amount of this voluntary effort underway. I think we need to do a couple of things. If there is a sense that we need to coordinate that better, we can do that. There's a website, readyscotland.org, which gives people a lot of information about that. I mentioned that in Parliament yesterday. We also, the announcement that was made, I think, last week by Aileen Campbell of more funding for wellbeing initiatives, that had as part of it funding to support community voluntary efforts, and therefore that recognises that there's a central role to be played there. And obviously people also need to have access to advice about how to safely, without putting their own health at risk, take part in these voluntary efforts. So as the question has been raised, we'll go away and consider whether there is more that we can do to support people, the vast numbers of people right now who want to contribute something to what is this national effort. Mark.
On Monday you said building sites should close. UK ministers are saying keep building. I've spoken to many big construction firms who say we take our lead, working in Scotland, I may add, we take our lead from the UK government. I've spoken to workers who said they've been told to turn up on non-critical sites, office blocks, things like that, and they're worried they won't get paid if they don't turn up. So who's calling the shots here in the construction sector?
Look, my advice as First Minister for construction sites in Scotland is that they should not be open right now unless they are working in essential projects like hospital building, for example. And I know many construction firms and sites that are following that advice, and I've seen evidence of that, and I've heard reports of that. This is an issue, and I've said all along we're taking a common UK approach. I think that's right. There will be times when there is perhaps a difference of emphasis because I have to do what I think is right as First Minister of Scotland. Other parts of certainly the UK government, as far as England is concerned, are taking a slightly different approach on this. But my view, and I have a responsibility, I think, to make my view clear here based on the health implications. We've said we will look at whether it would be possible to provide some guidance that would allow construction sites to operate safely. We are not yet in a position to say that is possible, so unless and until we issue that kind of guidance, then my advice is that construction sites should not be operating.
Sorry, what's your advice to the worker who's working on a non-critical site, whose boss said you need to turn up to work regardless of what you're saying?
Well, my advice would be to the boss and the operator of the construction site is that they should follow the advice in Scotland that the Scottish Government is giving. Now, I've said we're setting up a bit of a resource in the Scottish Government to try to offer more bespoke and specific advice where that is necessary. I have a lot of workers across different sectors, I'm not simply singling out construction here, emailing in for advice about what to do in these circumstances, and we will do our best to give that advice as quickly as possible. But I said in Parliament yesterday, and I want to repeat this today, it should not be for individual employees to be worrying about whether or not they should turn up to work. I am asking employers to be responsible. If the advice that you're getting is to close, then you should be closed. If the advice is to stay open for critical national resilience purposes, then you should be open, but following all the guidance. And for the companies in the middle, we are making available as much guidance to help them navigate these decisions as possible. And if there are employers out there who really genuinely can work out where their business fits, we will do our best to provide some bespoke advice. But employers should be putting the health of their workforce first. So if there's any doubt in the mind of an employer at this stage, and we may, as the weeks go by, be able to ease some of this, we may be able to have guidance that allows different decisions. But right now, the precautionary principle says that if there is any doubt in your mind, put the health of your workforce first. Yes.
UK government announced yesterday it's Nightingale Hospital which should be able to accept patients by Monday. Does the Scottish Government have this contingency plan? Is that underway?
There are contingency plans we have that would enable in the future, if we thought it necessary, similar initiatives. We have set out, Jean has set out, and I'll hand over to her in a second, plans to increase not just the intensive care capacity in our NHS, but the general bed capacity in the NHS, and we're working right now within our NHS and across our NHS estate to do that, and also to look at where there is additional capacity that, if necessary, we can add to that.
So I think I said at a previous press briefing that we were looking across the whole NHS estate to see where we could repurpose areas of it to assist us in all of this. We continue to do that and to look to see if there is more beyond that that we need to add. Of course, the really important point is that knowing the number or the level of spread of the virus and the cases that it will produce is very much dependent on all of us complying with all the rules that we have now asked people to comply with. So the more people stay at home and undertake all the other steps that we've asked of them, then the more we were able to reduce the high level of cases at any one point and spread that, which allows us then to match our NHS capacity to the anticipated need. But to be sure that we are covering all possibilities, then we are looking at what more we might need to do if we need more than the current upscaling of capacity that we're planning.
Also, just seeing that Prince Charles has been confirmed with COVID-19, is it fair that he was tested when the public aren't tested in NHS Aberdeen?
Can I say two things, and then I'll hand over to the Chief Medical Officer. Firstly, I send my best wishes to Prince Charles. And secondly, and I'm immediately going to hand over to the Chief Medical Officer, even with Prince Charles or people like him, there are patient confidentiality reasons that will limit what the CMO is able to say about this, but I will allow her to say what she feels able to.
I've discussed with the team in NHS Grampian, and from the information I've been given, it's clear that he was tested for clinical reasons. I'm very pleased also that he is very well, and as with many people who have had this virus, has had a mild illness.
Okay, yes.
Just on the Prince Charles, it's also the case that he's tested positive at his holiday home in Scotland and not his usual residence in England. What's your opinion on that?
I'm not going to comment specifically on that. I will repeat what I said to the general public on Sunday, that we want people to behave responsibly, so we don't want people to see the Highlands and Islands of our country as places where they can try to outrun the virus. That is not possible to do. Obviously, there are people who have homes in Scotland, and people will choose to go to their homes, but generally speaking, all of us should be responsible. Our remote areas are under pressure at the best of times with health services. By definition, health services are further away from people, so we don't want people putting further pressure on health services and other essential services in these areas. And of course, we've taken steps to ensure that the ferry companies are not taking non-essential traffic to and from our islands. Campsites and B&B should not be accepting visitors in that way, so that advice is clear. Okay, if there's no further questions, thank you all very much just now.